Have you ever been totally stumped by the anatomy down there? Whether you're sharing intimacy with someone who has a vulva or you have one yourself, confusion is far more common than you might think. I'm Dr. Jemmy, a urologist and pelvic surgeon, and today we're going to break it all down, every essential thing you need to know about female anatomy. And stick with me all the way through, because at the end I'll explain exactly what the infamous G-spot really is and what you should know about it. If you're new here, I'm a board-certified urologist who creates educational content on sexual health, bladder wellness, and so much more. So settle in and get ready to learn in a way that finally makes sense. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. Before diving into the specifics of anatomy, it's important to understand how it all develops. To keep things simple in this video, I'll refer to anyone with a penis as a male and anyone with a vulva as a female. When a fetus is developing in the uterus, meaning when someone is pregnant and their baby is growing, during the first 8 weeks, there are no genitals at all. The fetus has two tiny yet incredible starting structures that will eventually become either female or male anatomy: the genital tubercle and the urogenital sinus. Around the 10-week mark, the fetus begins developing male or female external genitalia based on the genes it carries. If they're XX, they'll develop into a female. If they're XY, they'll develop into a male. The genital tubercle, as you see here, forms the head of the penis in males and the head of the clitoris in females. Because these structures grow from the exact same original tissue, they become what's called homologous structures, meaning they share the same origin, similar structure, location, and even function. In both men and women, the head of the penis and the clitoris are born from the same tissue, the hood of the clitoris and the foreskin of the penis, also the same starting material. Even the lips of the labia, the soft folds you see around the vaginal opening, are comparable to the scrotum in men. Specifically, the labia majora are structurally similar to the outer skin of the scrotum. Everything you see in this diagram is called the vulva, and right at the very top sits the clitoris. As I mentioned earlier, it's analogous to the head of the penis, packed with thousands of nerve endings. For many women, clitoral stimulation is the most common pathway to orgasm, just as men often need penile stimulation for the same experience. The clitoris has its own hood, known as the prepuce, which can slide back and forth, just like the foreskin of the penis. Interestingly, sometimes the hood can actually stick to the clitoris, creating adhesions that may cause discomfort or even pain. Before we move further into the rest of the anatomy, let's take a closer look at the clitoris itself. The word clitoris comes from the Greek kleitoris, or kleis, meaning the key by which one enters the door, a poetic nod to its importance. Embryologically, it's identical to the penis, head, shaft, and all. While only a small portion is visible on the outside, the internal structure is surprisingly large, with extensions that split in two, much like the erectile tissue of the penis. Anatomical studies have shown that the nerves and blood vessels are arranged exactly like those in the penis. And yes, just like a penis, the clitoris can swell, fill with blood, and become erect during arousal. This erectile tissue extends around the urethral opening and the vaginal opening, branching out toward the sides, just beneath some of the inner lips of the vulva or labia minora. For many, these areas can also be highly sensitive. Just below the clitoris lies the urethral opening, the exit point of the P-tube. Your bladder produces urine, and it flows out through this opening. Beneath that is the vagina itself, a truly remarkable structure. Why? Because it has the ability to change shape in incredible ways. When a woman gives birth, it can expand to allow the passage of a baby. During arousal, it also transforms, becoming both wider and up to 3 inches longer. Finally, beneath all that is the anus. In women, we often talk about having 3 separate openings: the urethra at the top, then the vagina, and lastly, the anus. As I've mentioned throughout, The clitoris is the female equivalent of the penis, which is why so many women require clitoral stimulation to reach orgasm. But what about that much talked about G-spot? What is it really? Identified in 1940 by Ernst Grafenberg, it's located on the top or anterior wall of the vagina, about an inch or two inside. Many describe finding it by inserting a finger into the vagina and using a come hither motion, but it's not a magical button you can simply press. It's more of a zone with a dense concentration of nerve endings. Right above this area lies the Skene's gland, which is the female equivalent of the male prostate. I've spoken before about prostate massage and how some people find it pleasurable. Similarly, some women may enjoy stimulation of this area. But is the G-spot the ultimate key to pleasure? For some women, penetration that targets the G-spot can lead to orgasm. However, for most women, clitoral stimulation is still essential for orgasm. And that makes perfect sense, given that the clitoris shares the same sensitivity, structure, and nerve-rich tissue as the male penis. This is why, as I've explained throughout the video, the clitoris is the main source of sexual pleasure for so many women. I truly hope you've enjoyed this introduction to female anatomy. In my next video on female sexual health, I'll be diving into the topic of female ejaculation. So be sure to subscribe and don't miss it. And as always, please take care of yourself because you are absolutely worth it.